Hello and welcome to this webinar presented by the Massachusetts-Rhode Island MGMA in collaboration with the Connecticut, Delaware, Maryland, New York, Pennsylvania, and Virginia MGMA. My name is Emily Long and I will be your host. Today's presentation is led by Stacy Christensen. Stacy has more than 20 years of experience in communications. She helps customers create strategic communication and marketing plans to solve their toughest communication challenges. Her expertise includes brand identity and helping customers create integrated, personalized communications for their target audiences. Currently, she works in healthcare communications at Professional Office Services, where she helps create communication tools and strategies for practices across the country. Before we get started, I would like to review a few housekeeping items and let you know how you can participate in today's web event. The viewer window is on the right and it allows you to see everything the presenter is sharing. The control panel is on the left and that is how you can participate in the webinar. The audio panel provides audio information. By default, you have joined the webinar using microphone and speakers. If you prefer, you can join the audio by using your telephone by selecting Use Telephone under the audio drop-down box. The dial-in information will be displayed, including the audio pin. During the presentation, you have the ability to send questions to our staff through the chat box found on the left side of your screen. Simply type in your question and click Send. At the end of the presentation, we will do a question and answer session. As a final reminder, we are recording today's webinar. You can view a copy of this presentation and recording on the participating MGMA websites. Please welcome Stacy Christensen with How to Communicate with the Millennial Patient.
Thank you, Emily. Good afternoon, everybody. As Emily said, I'm Stacy, and I'm really excited to be here today to talk to you about communication with this younger audience, and this is one of the favorite things that I get to do in my job. I love to kind of step outside of the marketing research and strategy and do some of these presentations and engage with associations and practices throughout the country. So I'll get right to it, and as Emily said, please feel free to use the chat for any questions along the way, and at the end of the presentation I'll go ahead and address them. So what I wanted to talk to you today about is this new consumer patient that we have, the millennial patient. And so I'm going to give you some information, a little bit statistical, and then some of the latest trends and research out there. And what I hope you get from today's presentation is some really good best practices and tactical information to improve those practice and provider relationships that you have with this millennial patient. So I don't have to tell you that today's landscape is very competitive. And the provider-patient relationship really has never been more important. And when I talk about the patient-provider relationship, it's so much more than just that bedside manner. You know, the practice and that provider and patient relationship is so important because the provider oftentimes is being held accountable for reimbursables, profitability. You've got MACRA and some of the unknowns out there and this pay for performance. The whole notion of population health, you know, the movement now to make sure that providers and practices are really being proactive with their patients and making patients very proactive in their health care so that we can have, you know, healthier outcomes in our communities. And so there's a lot of pressure on practices today to make sure that they're engaging with those patients, not just from, you know, a profitability standpoint, but also to improve the overall health and wellness of the societies that we live in today. And so there's a lot of challenges that come with that for sure. Also, not to mention that this newest wave of patients, they're really consumers. And so if you've read a lot in healthcare today, you hear a lot about that sadly, you know, healthcare has become a little bit like shopping. There's so many options out there, and if patients aren't feeling like they have the experience they want, they're moving on. And so we really have to think about the patient in a little bit of a different lens as well. And something to note as you're doing that is, even though there's this notion of, consumerism out there, millennials, at the end of the day, they lack brand loyalty. There's been a lot of research done on millennials. And one of the things is that they really would do something that's more convenient, even if it wasn't, a loyalty that they held to a brand. So let's say that they love Apple and Apple devices, but if they're going to walk down and find that there's a better solution for them that they can get quicker and cheaper, they're going to go ahead and do it. And so this is a really tricky group, and there's so many of them coming up that it's really important to know how to communicate. I bet if you look out in your waiting rooms today, you can totally relate to this, right? And it starts even with, little one-year-olds who are sitting there with, the little kid YouTube videos on their mom's phones and their tablets to be entertained. And your waiting rooms look like this. The millennial consumer is connected at all times. And you know what? They make up a quarter of our population. So there's more than 80 million millennials out there. And what you need to know is that they're surpassing the baby boomers, and that there's a new generation coming through your practices that want to be communicated to differently. But before we focus a lot on the millennials, I want to have you keep your eye on Generation Z. So Generation Z, they were born, sometime in the mid-90s to early 2000, and they currently are sort of tied with the millennials, around 0.25% of our population too. And so you need to be thinking about this up-and-coming population and how you're going to engage with them and their parents as well. This generation is a little bit different than the millennials. They tend to be more independent, more in control. They prefer a little bit more privacy. They're a little bit more entrepreneurial. And something to note is that they didn't grow up with anything but technology. And this generation, they average 5 different screen uses daily. So from their phone to their tablets to their iPads, etc. And the reason why I want you just to keep your eye on this trend is that by 2020, they will consume 40% of our population. So we've got a couple different audiences coming through your practices that are going to demand to have their communication delivered to them a little bit differently. So, marketing is really all about communications. And for over 20 years, I've helped different industries and the latest healthcare really know their audience and figure out how to market to and message to their audience so that they can achieve whatever outcomes that they're trying. And certainly in healthcare, some of your objectives would be to fill your practice, make sure you're getting patients and that you're retaining them, that you're offering a great experience, and at the end of the day that you're getting paid and being profitable as well. So we're going to focus a lot on this millennial patient in the rest of the presentation today. So a couple things that you need to know about the millennials. They've kind of been tagged as the instant gratification generation. They really do demand a lot. I mean, they're online and accessible 24/7, and they want you to be known that way as well. They're tech savvy. If there was an app for something, they like an app for everything. They also they're not good about going to the doctor. And we'll talk about that a little bit later in the presentation today, which is a challenge for you when you think about marketing to them. More than 50% go to a doctor less than once a year. So at best, you might be able to get them in for an annual exam, but they typically don't like to physically go into the doctor's office. And so what can you do to put your best foot forward and really market to them? Well, first of all, be online, because millennials are online. They're digital patients, digital consumers. You think about today's world, almost all of us have some sort of a mobile device. 65 million households have a smartphone. 7 of 8 of the millennials own a smartphone. And they do their personal and professional business on their phones. And so you need to think about how are you communicating and sharing information about your practice online, because they are definitely online. So also, live in their space. They're very socially connected. I mean, this generation is referred to as the connected patient. They definitely do a lot of social media, but Facebook is not one of their primary, and we'll talk about that later as well. This generation does a lot of Snapchatting, Instagram, tweets, etc. But you need to really think about at your practice, what different communication vehicles and channels do you have to engage with your patient audience? Do you have a blog? Do you have a way to text patients? Take a look at your website. Is your website engaging to all audiences? Do you have good content in your services out there? And maybe you're really sophisticated and you've got your own apps as well. But, research stat that I recently came across said that 76% of millennials felt that it was easier to find information about a hotel than a medical provider. And so that means that there is some improvements that can be made with medical and healthcare practices today to improve their online presence. So it's not just enough to have a website or to have social media channels, but it's about making sure that they're performing well and that you've got the right content on there. I can't emphasize this enough. Communication at the end of the day, regardless of what audience you're communicating to, it's about personalizing it. If you think about it, when you go shopping or you go to see your provider or you do any sort of business exchange, you want it to be personalized to you. You want good customer service. And so this generation, you need to think about it like the Apple experience. What's in it for them? They want it to be convenient, they want it to be personalized, and they want it to be engaging. And so you really need to ask yourself some questions. Are we giving the best experience possible, and how are we engaging with this audience? And that's not easy. It's not easy at all because there's so much noise out there, right? When you think about all of the different communication channels and ways that you can engage with people today, it's really overwhelming. The latest research shows that patients get on average 5,000 messages a day. So humans, 5,000 messages a day. And you might be saying, well, that's impossible. But let me walk you through it. So let's say you start your day at 5:30 in the morning, and you don't go to bed until 11 at night. So think about all of the different points of data that your brain is processing in those, 15 hours. And it's a lot. Think about the human personal communications you have, the voicemails, the phone calls, the emails, the text messages, the newspaper reads, the mail. There's so much coming at you in a day that by the time you end your day, how likely are you to retain all of that information? Not very likely. And that's why it's so important to make sure that you're communicating often and in different ways. So practices will be successful regardless of what audience they're trying to reach if they remember that. If they remember that it's not just enough to send the mailer out, that it's time for an annual appointment. What else are you doing a couple weeks prior to send another reminder? What are you doing throughout the year to engage? You really need to think about communicating at least 4 different times before you take that necessary information. And this is why, and you could add several other gadgets to this, but it's a connected world. It's a digital world. No longer do you just do business from 8 to 5. It's a 24/7 world because you've got Twitter and you've got Snapchats and you've got Instagram and Pinterest and FaceTime and phone calls, the good old printed word. There's a lot of things going on in a lot of different ways to communicate. So I'm going to give you a few tips. Some of them certainly are some common sense, and some are a little bit more intriguing about how you can really engage with presentations. And I loved this quote that I read from a consultant recently. At the end of the day, even though it's a digital world, and even though we are talking about a digital consumer, it's not mobile first, it's not content first, it's stories first and people's first and conversations first. And so even though we are encouraging us to think about communicating in a little bit more of a non-traditional manner with this population, that doesn't mean that it still doesn't come down to very personalized communication and a relationship. And so how can we go about doing that? So at POS, years ago, we did some research that really dug into what we call the patient life cycle. And we identified that there were 5 particular areas of the patient life cycle that you could engage patients in when it comes to communication. And so that research led us to these 5 areas. So we'll walk through some of the communication tips and best practices along the way. So you have this opportunity with a new patient, how you're going to attract them, acquire them, get them in, and get them treated. And then, making that relationship and the diagnosis plan with the provider. And then once they leave their office, what does it look like when it's time to pay a bill? When you're trying to engage them throughout the year to get them to come back. What are you doing for practice marketing? And so those are the phases that we'll walk through today. So let's start with the new patient communication. So what are you doing? Ask yourself some of these questions. What are you doing to add value, valuable services? Because that's what they want. So the millennials today are very interested in convenient hours. They want those real early appointments. Think about, do you open up at 7 a.m.? Do you do any 7:30 appointments? What does post 5 o'clock look like? Is there only option in urgent care? Many practices now are starting to really adopt to hours up to 8 o'clock at night, 9 o'clock at night. Do you have weekend hours? What are you doing to make it convenient for them? When we talk about trying to attract patients, there's a couple of things that you should know. According to some recent research that the Harris poll did, 71% of millennials would like to be able to schedule an appointment via their mobile app. And many of them are interested in telehealth and concierge medicine where they don't have to come to you, you come to them. Whether it's through online appointments where they can see the doctor face-to-face, and in some instances in very large cities, this notion of concierge medicine where the provider might even come to you is something that I think we're going to see more and more of in the future. So sort of ask yourself, how innovative is your practice getting? One of the things that we need to do to make sure that we're communicating with any patient in the way they want to be communicated to is to ask them, what is their preference for communication? Do they prefer a phone call? Do they prefer a written reminder? You need to gain their permission for being able to communicate to them via text, phone messages, etc. So in your new patient packets, make sure that you've got an area where you're asking for their communication preference and gaining their consent to go ahead and communicate to them via a cell phone. And so certainly in order to be able to communicate with the millennial patients, we need to be capturing mobile phone numbers and emails, etc. So that's just a little tip to make sure to look at your packets. And then take a look at your website and ask yourself, should we be, if you're not, giving the ability for patients to schedule appointments online? And if you're giving that ability, make sure that it's prominent on that homepage. Again, this is a digital world, and people tend to do a lot of their business after hours, or they want to do it when it's convenient for them. And having a strong online presence and engaging that way is critical as well. Something else to keep in mind with these younger patients as you're welcoming them, and it's not just millennials. I think we're seeing a trend in patients in general where they really prefer text reminders. How often do you see a phone number on your phone that you don't recognize, or you get interrupted during the day and you don't really want to be answering that phone? And many of us don't even listen to our voicemails. So some of the research out there will say that, almost 90% of texts are read versus, 45% of an email or a voicemail. And so if you're looking to make sure that you have a full calendar for your providers and you're booked solid, you want to make sure that those appointment reminders are getting sent in a way that they're going to be well received, and text is definitely something that is increasing and growing. And so think about, offering a really good first impression and a good experience too. So if you're attracting these new patients, you want to sell them. you want to let them know that, this is everything that you should know about our practice and our providers, and consider sending them, maybe even a welcome email. You can't do all that information via text, and so certainly collect their email and see if they would be willing to go ahead and check and read a little bit more about you. Make sure that your forms are on your website so that when you've got patient registration materials, they have a chance to fill that out ahead of time. There's lots of things that you can make sure that you're doing to make a good first impression. So hopefully, you've attracted the patients, you've got them in, and now they're here to get treated. And that's hard, right? Because this generation is referred to as the drive-through patient. And the reason why is because before they even come to you, they've done a lot of research online. And many of them will even try some self-treatments at home first, because remember, only 50% of them come to a doctor once a year. They don't like to go in and see a provider in person. And so when you think about that, it makes sense, because in some ways, this population is driving up the cost of health care. Because think about all of those retail clinics and urgent clinics that are popping up. So you've got a great opportunity to start creating a relationship with these patients so that they will come back. So it's important to have a strong online presence. If they're searching online, make sure that you're out there. Have a welcome video from your practice. Make sure that when they're searching for a provider in your area or a certain condition or diagnosis, work with your web team to make sure that you have an optimized website so that when people are searching for keywords and terms, that you're going to come up on that first page. And then, as unpopular or popular as this may be, it really depends on it's a little bit political and definitely fragmented when it comes to people's thoughts on telehealth. But the Pew Research Center continues to do research on this, and I don't think telehealth has taken off the way that we thought it would a couple of years ago, but it's definitely trending upwards. And, you've got a huge percentage of the population in general that would love to be able to dial in and see a provider face-to-face via the screen than have to go in person for some of those common diagnoses. And I think that we're going to see more and more of that. Again, we talked a lot about the digital reminders and the text reminders. Certainly you're going to have better attrition rates and so forth, and have patients show up when you do send those text reminders. So hopefully the patient has come in, they've met with the provider, they've gotten diagnosed or treated, had as good of an experience as they possibly could, and now we come to what could be arguably one of the most important communication exchanges you can have with the patient. And it has to do with financial, has to do with paying their bills. And the reason I say it can be in some instances the most important is because it is the livelihood of your practice. At the end of the day, hopefully we're all in the business of healthcare because we're passionate about, changing, patient outcomes, and treating them, improving their health and wellness. But in order to keep your doors open, you have to get paid. And so we know that that's becoming harder and harder. So let's look at some of those trends. The millennials, they shop. It's unfortunate, but they do shop around. They're price savvy, they're competitive, right? Since they don't have much loyalty to a certain brand or to a certain practice or doctor, they're likely to go where it might be a little bit cheaper. You need to understand that they're coming of age. This is the first time that they're sort of out on their own, and some of those in their mid-20s, out of mom and dad's insurance for the first time, have their first job. They might want to really not understand. They don't understand their insurance because they're just learning how to live on their own. And I know that is such a sticking point with practices across the country today, that frustration that you have become insurance experts. And so what can you do to really help educate them? You need to understand that what they want to do. First of all, they want to be online. They want to be able to pay you online. They want to be able to have you send them their e-statements so they can pull them up on their mobile devices. And so know that as you think about sharing financial policies, engagement, look at how your practice does their billing and how they collect their payments, and see if you can improve some of that along the way. So one of the things that is very important with any audience, obviously, is that you share your financial policy and what a patient's responsibility is. And especially with, the younger patients that are coming in and paying bills for the first time, really take a look at what collateral they're getting at the time that you're registering them as a new patient. Do they really understand what their financial responsibility is? Can you provide any sort of estimates ahead of time? So take a look at that collateral and see what you can do. Do you really have clear expectations at the time that they're registering that they have a co-payment due, or that it's their responsibility to understand their benefits, that sort of thing. And so a lot of practices will choose to, put some signage up in the waiting rooms, some signage up in the hallways, things like that, so that they're communicating more than just in that welcome packet. And then think about this, I get a lot of collateral from practices that we work with throughout the country, and a lot of them do have actual patient education materials that they've done for their practices that educate about insurance coverage, because so many of the practices have had to really understand the different insurance plans that they accept. They've decided to turn that into some informational pieces that can be a leave behind for patients to really help them digest that information. So what can you do to be patient-centric and really have a friendly billing and payment solution that's going to engage these younger generations so that they're going to pay you? I really think it comes down to technology, and technology sometimes can be the bane of our existence, right? We know that. When it works, it's great, and when it doesn't, it doesn't. But we've got to be able to constantly evolve and become better at embracing technology. And so if you're not offering a way for patients to pay their bills online today, or deliver them an electronic statement instead of mailing out a hard copy statement, or setting them up for past due reminders that they get via text or phone, you want to really take a look at that and ask yourself, could we be collecting more money if we did a better job in digitizing our billing and payment opportunities? So this is a little bit of research that was done on the percentage of people who would prefer to receive an electronic statement. And you can see that 50% of healthcare patients today would really like to do that. And we know that out of all of the industries, healthcare has been slower to adapt to online financials. And I don't know if that's because there's a little bit of, the concerns around HIPAA and breaches and security that there's a delay, but we're seeing an upward trend in healthcare starting to adopt some of those digital strategies to be more profitable. And the reason is because it goes back to convenience. So younger families who are working 8 to 5, a lot of them, I would be in this boat, although I'm certainly not a millennial anymore, but I'm a working parent. My husband works. I have 3 very active children. I do a lot of our bills and work at night, at 9 o'clock or after. And so if I'm given a statement, it's going to sit there and get kind of lost in the paper on my kitchen counter. But if I've got something in my inbox, I know that I can go on and do my work 24/7, not have to go to the post office, get a stamp. I'm going to do as much business through an online transaction as I can. And I think that's what we're finding more and more of. So consider looking into online bill pay. That would be a big tip for you today. Make sure that they've got some of those features out there. What you're going to want to look for is guest pay. I read something that the average person has 25 passwords. That would certainly be true for me. So think about all the different logins and passwords you have. So you want to be able to have patients be able to pay their bill without having to log into their accounts every single time as well. And just make sure that you've got a way to have as many features as possible that will make it easy for them. And then when you're doing that, make sure that you're putting your best foot forward. I want to say something about your billing statements. Every practice has a billing statement, whether it's electronic or printed. If I could give you one tip today, make sure your logo's on it. That's kind of branding 101. I've seen a lot of ugly statements out there, and it's going to be hard to get paid and create a relationship if it doesn't look like you. And if you offer online bill pay, make sure that you call it out a couple different times on that statement as well. And then drive adoption. You know, a lot of practices who have embraced technology do have challenges and struggles in getting marketing it to their patients, and especially sometimes the older generation. They don't know that they have the ability to go on and do that, so you need to make sure that you're doing as much as you can to promote that. So look at different ways you can market that, and this statement insert that you put in their bill is just one example of that. Take a look at your website. How easy are you making it for patients to understand their patient financial responsibility? Do you have policies on your website? Do you have a pay your bill on your website prominent? So some tips for you to really take a look at your website and see what you can do to improve that functionality as well. You need to understand, because this generation, again, like I said, is learning to live on their own. 38% of millennials pay a bill late. They forget. They're a little scattered. They're learning how to get organized. And so we're seeing a lot of practices adopt text reminders, whether it's a phone reminder or a text reminder that there might be a past due balance or that there's a payment due. And remember that 98% of texts get read. So it's a very powerful tool. Some of the case studies we've done have seen a 25% increase in patient collections as a result of having automated reminders. So another tip, if your practice isn't doing that, that might be something to consider as well. So hopefully you've gotten that bill and you've been able to get paid, because we know that that is an ongoing challenge for practices throughout the country as deductibles get higher and higher and that patient owns nearly 50% of the responsibility. We know that we have to make it as easy as possible for them to pay. So now, what are you doing after they've paid you to create that relationship? Don't look at the patient as that drive-through patient. That's not what you want. You want them to come back to you. So throughout the year, what does your practice do to send out communications to keep your practice top of mind? You've got some challenges with this particular group because 93% of them don't schedule preventative physician visits. They really don't think it's necessary. Again, they don't go to the doctor very often. 50% have no personal relationship with a provider. So you've got some marketing work to do here. So here's some ideas. They're a gadget society. They wear smart watches, Fitbits, Apple Watches. They love to track their fitness and their health. 20% of millennials wear some sort of health wearable. And so many of them also have different health apps on their phone. So think about how you could live in their space and get out some communication through those devices as well. And they would like to engage with your practice. They would like to be able to log in and see what their lab results were and things like that. But don't think that it has to always be digital. Direct mail is coming back. And the reason it's coming back is because we've gotten a little saturated in our email marketing. I mean, how many emails do you get in a day that you just simply delete, right? It's spam. Or you get so many that if it's not really something really pertinent, you're not going to read it. And so there is an uptick in direct mail performing better than email campaigns. And so think about this stage that we call kind of the education and preventative. What you can do to communicate to patients. Now, this certainly isn't for a millennial patient, but think about screenings. So you could be thinking about screenings from the age of 18 up and having some sort of an annual campaign that's personalized, that tells a story. Emotional marketing sells, and emotional marketing works with all sorts of audiences. And so when you think about getting people in for mammograms or getting them in for HPV vaccinations, meningitis vaccinations, just their annual screenings. Put it in a way that tells a story. So Claire was diagnosed with cervical cancer, but because of early detection, she's been able to have this many more milestones. And then use that to say, you should have a screening every X amount of years. I mean, a lot of practices are starting to really look at those screenings and saying, how can we get that information out to help have healthier communities? It ties so well to population health. How are you engaging different populations and different age groups to come in for those screenings? And we know that screenings for a 25-year-old to a 40-year-old woman is different than a screening for a woman 55 plus. And so there's a great opportunity to look at that and say, how are we communicating that information? We also know that millennials love deals, right? So this works great for ophthalmology practices, dermatology practices, people that are offering specials on, maybe it's a skincare or med product or something. Direct mail works. Maybe you're announcing a new provider, having an open house, having a new service, a special event in your community. Don't underestimate the power of mail. Just because they don't like to go to the doctor doesn't mean that they don't care about their health and wellness. They're really into those fads. They care a lot about nutrition. They care a lot about skincare. They care a lot about fitness and diet. They're into holistic health. So knowing that, think about how your collateral and your communications are reaching that audience. How are you promoting wellness? Maybe you've got something that talks about diet and sports and wellness and, how many calories they should be, tracking a day and speak their language. How can they track that and tie that back to some of those wearable devices, things like that. You want to be relevant. So think about, your marketing. So patient acquisition, that phase of the life cycle is a little broad, right? It really is about putting on your marketing hat and thinking about how are we going to get patients coming into our office. And certainly, looking at an empty waiting room probably strikes fear in many of you, I would imagine. This is not going to help make us profitable, nor is it going to help us have healthy communities. So what can we do to really attract the millennials? They relate more to personalized experiences. So remember when I talked about telling a story and having conversations first and stories first? Market with real people. If you have the budget and the ability to be able to do some live photography shots with your provider, showing a real provider, real patients, and not stock photos on your website and your collateral, I highly recommend, doing a professional shot so that you can really have kind of humanized, personalized content and stories. And think about that. Again, this is kind of like that postcard about Claire and the cervical cancer. Think about talking about how an early diagnosis can help somebody. So, Jana, Jana's story, she tanned a lot in her 20s, skincare, precancerous cells, getting someone to come in for a screening, knowing they don't want to come to the doctor is tough. If they're not going to come, you really need to pull on their emotional heartstrings and think about telling some of those videos on your website, seeing if a couple of patients will share their stories with you, getting it out there. I talked earlier that direct mail was not dead, and direct mail is still a very powerful marketing tool. So I know I've talked today a lot about digital marketing and being online, but it's a balance. Because remember how you have to communicate something 4 different ways for the patient or a consumer to take the necessary behavior? There is power in the printed word still. I'm a journalist at heart. My background, certainly I was, public relations, minor in journalism. I'm a writer. I'm probably kind of, a little bit different than a lot of people in their mid-40s. I still like the written letter. I still like the handwritten thank you note. I think there's a lot of power in that. I've certainly adopted with 2 teenagers in the house. I certainly have to do that. But I love getting a good direct mail piece. And millennials do too. They like engaging with that. 84% of them will take time to look through the mail. 98% check their mail on a daily basis. You're going to have better engagement and recall with direct mail oftentimes than an email campaign, because the latest statistics from the post office show that digital mail has a 2% better response rate than emails. And so take a look at what you do for mailings throughout the year and remember those stats. Have fun. Get social. And know, again, it's beyond Facebook. Facebook is a little bit of a fading fad among this particular age generation. I think Facebook is very popular among those a little bit more sophisticated in their late 30s, 40s, and upward. But this generation, and certainly Generation Z, does a lot of their communication in Snapchat and Instagram, and they're watching YouTube videos. And so take a look at your social channels and say, how can I communicate and engage? How can I have a screening campaign and push it out on a number of different social media channels? Because millennials will engage with brands on social media, more likely so than any other way. Maybe consider having a blog or a forum on your website. Some tips for you to kind of think about different ways to engage and have communication. Practice marketing is a lot about the patient experience. At the end of the day, if a patient is not having a good experience, they're going to move on. And so it's really, really important to know and understand what they think of their interactions with you. And again, it goes beyond that bedside manner. It goes beyond waiting times in the office. Certainly those are still critical things you want to know about, but it's so much more. What was the personal communication like with the provider? What were they given when they left the office on their diagnosis or next steps? And so practice and provider reviews are very popular in marketing today among healthcare. You are going to continue to read a lot about the importance. And if you use this as kind of a benchmark, if you don't have the ability for patients to go online today and give a review, I would highly encourage you to consider setting up some ways for them to do that. Certainly Google Plus is very popular, Yelp. When you want to do specific provider reviews, you can do ZocDocs, HealthGrades, RateMDs, but you want to be online and you want to be able to get patients to give you reviews, and you hope that they're positive. But negative reviews also give you the opportunity to know where you can improve. And a good benchmark for you is that you want 20 to 30 reviews in a given year on one particular platform. So if you've got 2 or 3 different online review platforms, you're really striving for 20 to 30 reviews in a given month, or a given year, excuse me. But you want to make sure that you are letting patients know that you want to hear from them. It's not enough just to have a social media channel, just to have online review platforms. You need to let them know where they go and how they go and what they need to do. So when they're leaving their practice, take a look at your business card. Maybe you do something different on your business card where on the back you've got your social media channels or your online review sites, and you're encouraging patients to give you a review. Maybe there's a RAT card that says when they're leaving, the provider or the front desk gives them a card that says, "Thank you. I really appreciate, you coming today. Your feedback's important to us. We would like to hear from you." And you go ahead and you do that as well. So make sure that you're promoting that. So that was a lot of information, and I get really passionate about this. I'm sure you can tell. I just love talking about this generation. I love talking about communication. Again, it's just about knowing your audience. You've got a lot of different audiences you serve. Not everything we covered today would work with certain, ages and generations and demographics, but hopefully you gain some valuable insights in engaging with this particular generation. So in summary, continue to evolve. I love this graphic. It's a little tongue-in-cheek, but think about it. I mean, look back to over 100 years ago. We've come a long way if you look at just phone communication. So continue to communicate, continue to know your audience, and have a really nice balance of digital and traditional marketing. You can't communicate just in one way. I mean, if you put 100% of your time and effort into just digital, you're still going to be missing out. So you really need to look at your communications as a whole and say, okay, I want to market and I want to attract new patients. How am I doing that through traditional marketing, and what am I doing digitally and online as well? Be open-minded to new technologies. Embrace technology. Be innovative. Have some fun. Really humanize your practice. Get social. It's okay to show the human side of your providers. Maybe you're having a special event or they're dressing up a pediatrics office for Halloween. Post some pictures. Personalize the experience. Have fun. Communication should be fun. Remember, communicate often. And I'll close with this cartoon. It's a little hard to read, but I love it. The evolution of communication. The Stone Age, the written word, the typewriter, movable type, the mass communication, the manuals, the publications. When email came on, it was a huge deal, right? Well, now it's Twitter. It's like, how can you communicate in 140 characters? How can you get your message out? Because that's about as much as people want to read anymore. And I think that is just a really fun and very relevant picture of what we're up against today, because it is challenging. So that ends our presentation. I'm going to open it up for some questions. Just a little bit about POS. So we're headquartered in Waterloo, Iowa. Healthcare communications company. We've been around for almost 50 years, and we just help practices communicate and engage better with their patients. And it's exciting, and we do that through a lot of different ways, and we do that through helping practices improve their marketing and then improve their print and digital communications and the overall patient experience. So I've really, really enjoyed the time. And I see that I've got a couple questions here, so I'll go ahead and get at it. This would be a great time now to ask anything you'd like in that chat line as well. So let me see if I can sit through here. Susan, you said that paperwork they leave the practice with is really important. What kind of information on an after-visit summary is currently trending? It depends on the nature of the practice and what they were in for, but certainly patients need to leave with some sort of a checklist. So if it's an ambulatory or they've got certain medications to follow or certain procedures, they really need to leave with something that is written or a piece of paper that's coming to them that tells them what the next steps are, what they need to be doing for post-care, post-treatment, when they need to come back. I'm also seeing a lot of practices give those social media review cards that I had on the screen, online reputation management, survey reviews, and engaging with them on social media platforms. They want to connect with them, and so they're giving them information to let them know how to do that. That is definitely trending up as well. Getting tons of feedback that this was great communication. I'm very happy that you enjoyed it. A copy of the presentation will be sent out. I believe Emily sends a PDF out of the presentation, so you will be getting the deck. Let's see, Peter, you mentioned holding credit card on file. Any idea of what percentage of providers are doing it? Yes, so those practices that are adopting online bill pay, almost all of them are having credit card on files. They're setting up automated payment plans and being able to store that so that it's easy for the practice to do, to collect that information and bill automatically, but it's also easy for the patient not to have to key that in every time. So if you're doing online bill pay, I don't have an exact percentage. The majority of them are doing those credit card on file as well. Are there stats on millennials' preference for bedside manner during their visit? That's a great question. I haven't seen anything about that. The research has been more on not necessarily bedside manner, but wanting to engage with the provider digitally. They wish that their provider would have healthcare apps that they can exchange information directly with the patient on via mobile. They're wishing that they could engage with their providers more through their health data information on the mobile. So not so much on that touchy-feely, but more so on the apps and being able to exchange healthcare information online and asking questions of their providers digitally. The personal relationship is really important to us, and it's important for providers. At the end of the day, the millennials, it's not nearly as important to them. Are there stats? Let's see. I think I addressed that one already. I'll give you a couple more minutes. Lots of comments here. I'm glad. Just some good stats. If there's anything else that I didn't address, if there's other questions or research stats that I could look into for you, I would be happy to. Otherwise, I think, Emily, that concludes our presentation. I had a great time. I hope all of you did as well. And I wish you a great weekend, and Emily will be following up with you.
Thank you, Stacy. I'd like to thank everyone for attending today's webinar. The recording will be distributed to all registrants through email. If you attended today's webinar as a non-member, please inquire about membership opportunities through your local MGMA chapter. At the conclusion of this webinar, you will be sent a brief survey that will ask you to rate the webinar on a 5-star scale. A separate survey will be sent to your email for a more in-depth look at today's program. That concludes our webinar. Thank you again for attending, and have a great afternoon.